So welcome everyone to WebChat, I believe number 49. And this is one of our coronavirus and co-housing WebChat series. We've been talking about that subject of coronavirus and how it impacts us as co-housers and how we are working with it and how we can be together as a community around that for several weeks now. This is a free service of the association, and we want to let you know that although we don't charge for it, we do request donations to support it because it does not in fact happen for free. That the staff of the association is very much involved, and there are other expenses involved with making these things happen and the infrastructure that has to be maintained so that we can let you know that it's happening, for example. So donations very much appreciated. Speaking of staff, I should introduce myself and Karen. So I'm Karen Gimnig, and I am the Communications Director for the Co-Housing Association. And Karen Hoskin is with us, and she's the Executive Director. And I thought we were going to have a couple of board members with us tonight, but I'm not seeing them at the moment. Some of our most stolid volunteers are here. Thank you. The topic for tonight is preparing for COVID-19 illness, and Gretchen is with us, and she is a nurse and works in the medical world, and more importantly perhaps is a member of the health team at PDX Commons in Portland. And Gretchen has been working with that team. I'm not aware of another health team that has worked as rigorously or as thoroughly as that team has. And we invited her tonight to be really give a case study. So the idea is she's going to be explaining what PDX Commons has done, recognizing that a lot of that will be an excellent model for the rest of communities, and even people who don't live in community, I think will learn some things that will help prepare for the situation. And also recognizing that some of it may be specific to PDX Commons and not appropriate or not something your community is ready to consent on. So not necessarily, or certainly not trying to tell communities what they should do or must do, but just inviting you to some information about what one community is doing and how it's working for them based on this health team that has, is it 5 folks with medical background?
There's 7 of us.
7.
Out of 38 people.
Yeah. So a broad spectrum of, expertise there. And so really excited to have Gretchen with us. So Gretchen's going to share, we allowed 90 minutes for tonight instead of our usual 60 because we have a ton of information and we wanted to make sure there was time for your questions and comments at the end. So we're here for 90 minutes. We'll probably take a brief break in the middle just because I don't believe in asking people to sit for 90 minutes straight in front of a computer. And with that, I think
I'll screen share. Okay, hi everybody. I think that Karen has already pretty much given you a good introduction. I'll just kind of reinforce some of that. I'm a master's prepared nurse. Actually, I was a nurse midwife and a nurse educator, so I've done a lot of teaching. I'm now an advanced care planning facilitator and, of course, a member of the health team here at PDX Commons in Portland. So I'm going to just review some of these caveats, and that is that the material that I'm sharing is primarily relevant to our own setting here at PDX Commons, and I'll explain a little bit about that one. We're 38 people, almost all of us considered vulnerable to serious COVID-19 illness due to our age and pre-existing conditions. We have an average age of 70. So you can imagine that people here have been very concerned about this. We live in a single urban building with a lot of common spaces and individual condominiums, and the condominiums are connected by external walkways, which is, wow, we're really grateful for that right now because we can do a lot of yelling across the courtyard at each other, which is pretty fun. We're in Portland, Oregon, where community spread of coronavirus has been well contained by statewide physical distancing measures and extensive closures. I think that in Oregon, we only have had so far, and I say only, not to treat it lightly, but we've had 75 deaths relative to other states. That's pretty good containment, although very unfortunate for those people. So the fact that we're a bunch of seniors living in a building that's only accessible from the outside through a door, and then we're all in common space together to reach our homes, becomes a design feature that makes our need to control for COVID perhaps more than other people who have separate buildings. And of course, we don't want you to take anything that I'm giving you as medical advice, which obviously seems appropriate. So our healthcare team is 4 nurse practitioners, 2 nurses with acute care experience, and a family physician. We're all retired, but we're all very much engaged in trying to help our community be as healthy as possible. So we've been active as a team since before we moved into our building in mid-2017. A lot of what we do has been to plan regular educational presentations on healthy aging. We bring in people from the outside to give us all kinds of really interesting talks, and we learn a lot. We also provide a lot of health support for our residents with various health needs like post-surgical recovery or common illnesses or questions or you know, just figuring out ways that we can support the care and advice they've gotten from their primary care providers. So we do a lot of stuff. We fix the first aid kits. We have worked with food safety, food handling safety with our kitchen people, and so we're just kind of involved in a lot of stuff. But I tell you what, the appearance of the novel coronavirus in the United States just kind of put us on fire. And we started very early on creating recommendations for community guidelines. We saw this coming before either the federal, state, or local government were acting, so that by the time they did start to act, we already had guidelines that we were ready to recommend to the community. We did develop a series of precaution levels, and you will get a copy of this as a resource, which ramped up as the threat increased outside of us. And our express goal was to protect our home and all of our PDX Commons residents from becoming exposed to COVID-19 by cooperatively maintaining a level of precaution appropriate to the current risk and consistent with recommendations of public health experts and/or orders of our governmental leaders. So our primary goal has been and mostly continues to be keeping COVID-19 outside of our doors. And that's a pretty tall order. There have been a number of challenges, and I think that some of your web chats have gone over some of these. So I will just detail some of the ones that we've struggled with, because this is something that co-housing communities have never had to face before. I mean, these are decisions that aren't just like, what's our budget going to be, or, you know, is it okay to accept this donation, or those. I mean, these are decisions that could mean someone's life. And it's just such a profound thing that we're trying to have 38 people agree on when we feel that lives are literally at stake. So the first challenge is having everybody recognize that we have several members of our community who are at particular risk for severe COVID illness and death. We have people with COPD, asthma, diabetes, kidney failure, heart problems. We have people who, if they got this, could very well go down a road to a very serious illness. At the same time, we have this wide diversity of risk tolerance for the threat that's mostly outside our doors. So we have had people who have been isolating pretty much inside their homes since before this even made an appearance in the United States. Like, if I get this, I'm going to die. I'm not even going to go out. We have other people who feel less at risk, who feel less concerned, who think, you know, this is all going to blow over, it's going to be fine. So we somehow had to find the middle road between these two groups. And most of us are in the middle somewhere, but we do have people on both of these ends in our community. And because we recognize that we would need to make some rapid responses to a quickly evolving situation, we had some complications. And part of those complications are, despite the fact that we have a really savvy and highly educated community, there are varying levels of knowledge about the novel coronavirus and the risks to the community. Some people are very into that news, and some people like, I don't really want to pay that much attention to that. We have a lot of issues with the desire of some in the community to have fully participate in every decision. We always make our decisions together, while at the same time we were asking them to allow the health team to make some proxy decisions for the community. So we had to struggle through that difference of opinion about whether every decision that affects the whole community has to be made by the whole community, which would have required a lot of special all-community meetings. There's also the desire of some of the community for autonomy, which is kind of that idea like we're all grown-ups, we're all adults, we're all reasonably intelligent, we can make good decisions for ourselves. Why do we need the community to tell us what we can and can't do? So that came up. There certainly is a difference in the degree to which each person feels responsible for everybody else in the community. We like to think that we all feel responsible for each other, but when push comes to shove and I really have to restrict my life, it gets dicier. We also have had some reluctance to give up important parts of our social life unless the government outside mandated it with the stay-at-home order. And that has been actually especially hard on the grandparents. I think asking grandparents to stop seeing their grandkids has been really trying. So we've had to work with that. Certainly the awkwardness of attempting to do community life at an appropriate physical distance has been a challenge. We started with 3 feet and then went up to 6 feet over time. We started with, we can only have enough people in our great room that we can do 6 feet of social distancing to, we can't have more than 10, and now we're down to, we can't have more than 5. So our requirements continue to shift. We have disagreement about whether the business of the community should be postponed or continue. We have people say this is a crisis. What are we doing business for? We have people who say, we've got nothing else to do. Let's just get some business done. So that's been an issue. We have an evolving, as we started talking about being ill with COVID in the community, we have questions of the right to privacy versus the need to know. And that may come up in some communities. I know there was just an article in I believe it was the Washington Post over the weekend that some of you may have seen, where this is becoming an issue in apartment buildings and with HOAs, is how much do people have the right to privacy and how much does the rest of the community have a need to know if there's COVID in the building? And so that remains an ongoing open issue. And you may have noticed that when people get stressed, and I don't know who's stressed besides us, but just say that everybody's kind of stressed, that sometimes we have less than functional social interactions. So under stress, we oftentimes aren't our best selves. So we're trying to work with these issues, oftentimes we're getting our buttons pushed all over the place. And I think that's just a result of stress. So we kind of worked our way through all of those and came to some solutions. And the community finally, after a lot of discussion, did designate the health team to make the recommendations for community precautionary response. They put a layer of backup on it, though, with HOA officers. We have 4 HOA officers elected. I am actually the person who sits on both groups. And the HOA officer reviews and then approves those recommendations for immediate dissemination and implementation to the community. So these 2 groups are essentially acting as proxy for the whole community. The community, however, can discuss implemented recommendations at the next monthly committee of the whole meeting, which is what we call our business meetings, with the potential to modify. We just had our first committee of the whole meeting since April. We had it on Sunday afternoon, and so the community did have a chance to discuss implemented recommendations of the last month, and there were plenty, and nobody chose to challenge any of those, so we feel like that was kind of a mini victory. As a result, we instituted precautions level 1 to 4, and level 1 is kind of our baseline level of precautions, you know, wash your hands kind of stuff, all the way up to number 4, which is a lockdown, which came with our Oregon stay home, stay lives order. So this is really how we work to keep the coronavirus out of PDX Commons. And we are on total lockdown now, so nobody comes into the building except for residents. And we don't leave the building unless we're leaving for an outdoor walk at appropriate social distance or for an essential task. And then we decided as a health team that we really needed to get our game on about what happens if somebody does get sick. And so we created the guidelines for the presence of COVID-19 illness in our community. And that's both how we contain the coronavirus if it does enter PDX Commons, and it also includes individual planning for the COVID-19 illness, which was a really interesting feature because it threw a lot of our community for a loop. And I'll talk more about why that was. It's really a whole different ballgame when you have to sit down and write a plan for what happens when I get sick. Still to come, of course, is how we back out of this after the most acute threat has passed, but we know that the risk of infection remains for at least the next year and probably more. I'll talk more about that later as well. So the first few things we did to get ready as a community for illness is trying to figure out who has a thermometer and who doesn't. And it was a surprise to me how many of us, I would guess at least a third of our community, did not have an operational thermometer. So that was one of the things. Our goal was to make sure that at least one working thermometer was in each household and that people knew how to use it, which is a really good thing. We had some people who say, well, I've got one of these, glass mercury thermometers, but I don't know how to read it. It's like, okay, you're going to have to get one of those digital sticks, okay? So we were late enough to the game that was a little bit of a challenge to get everybody a thermometer, but we did. We asked everybody to take their temperatures every now and then so that they learn their own normal, and we would define a fever as any sustained temperature at least a degree above their own. Now, for those of you who don't understand the physiology of older adults, it's probably good to know that older adults' baseline temperature is often lower than 98.6. In fact, oftentimes it's in the 97s range. And also the older adult body is not, it's sluggish to develop a fever. And so oftentimes a fever in an older person is not 100.4, which is how we would define a fever in an average adult. So what we're trying to do is get the community to recognize what their own baseline temperature is so that they could recognize what a fever would be for them. Our second question is, how many pulse oximeters do we have? And again, if you're not familiar with COVID, one of the things it does is it loves to go to the lungs. It doesn't go to the lungs of everybody, but it goes to the lungs of most people who get a serious disease, and they develop bilateral interstitial pneumonia. And what that does is it prevents the lungs from absorbing oxygen from the air and transmitting it to the blood. So pulse oximeters help to read the oxygen saturation of blood. And one of the things we know is that in COVID-19, people can feel and look relatively well with really dropping oxygen saturation. So we were gathering pulse oximeters in the community just so that we know who's got them, so that we can pass those into sick rooms if we need to, so people can monitor their oxygen saturations. And then we also went on a hunt for medical grade masks and other PPE that people might have stashed away from previous hospitalizations or procedures. And so we gathered all those. We also did do a cloth mask making party, and we made cloth masks for everybody in the community. We finished the day that the CDC changed their recommendation and decided to recommend them. So we felt like we were pretty smart. So we have a lot of very nice cloth masks being worn. So what I'm going to show you now is slides that we presented to the community as part of a webinar on what we're going to do in case of COVID illness. So I'm switching from slides that I created to you to slides that I created for the community. So this is what we showed to the community last week. So we're planning for what we hope won't happen. In addition to helping us avoid COVID-19, we need to be ready for it should it arrive. And in order to protect us, there has to be an appropriate and rapid response if somebody does get sick with COVID illness. We emphasize that maybe it won't happen is really not the plan we should rely on, and that while it's very scary to think about, not thinking about it is dangerous for all of us. So why are we making this much fuss? It's as we know, it's not just like any other virus that we see at PDX Commons, that this one can lead to severe illness and death, sometimes within just a couple of days, or it could leave us extremely sick for a week or two or more before we recover. Nobody has immunity, we're all susceptible, and it's got this darn silent spread going on with either asymptomatic or pre-symptomatic contagion. And that's the hard part is you know how it is, how you look at each other and say, you could have it. You could breathe on me. Keep your distance. The toll, according to the CDC, is that 8 out of 10 COVID-19 deaths reported in the US have been in adults 65 and over. So our age group here at PDX Commons is hard hit. We know that. Of all adults with confirmed COVID-19 in the US, the CDC says that our age range, and we do have some people under 65, our oldest person is 40, but this is approximately our age range, is a third to a half of us could end up going to the hospital. Up to a third of us could end up going to ICU, a quarter to a third. I mean, that's a lot. That's a lot of us that would end up in intensive care. And, it would not surprise anybody if 10% of us who were positive actually died from this. So this is not something to just like, oh, it's not that big of a deal. I mean, we really are talking some heavy duty consequences to this illness in the older population. So we wrote these guidelines. The health team wrote them based on CDC guidelines and our own knowledge of isolation precautions. We also told the community that we believe standardized guidelines are necessary, that even though we trust this community to be smart and savvy, that having everybody sort of guess what to do if they get sick probably isn't going to be the safest for the whole community. And the HOA officers approved this basically pretty much, well, that was level 4. Yeah, this was what, 10 days ago-ish, almost 2 weeks. The officers approved this and it became enforced. So the first part is monitoring symptoms. We're asking all the residents to monitor themselves for new onset symptoms. So we wrote new onset because some people say, well, I always cough. It's like, no, this is new, different coughing. We're particularly looking for that trifecta, which is the fever, the cough, and the flu-like symptoms. Especially when those come together, that can be very concerning. The shortness of breath oftentimes develops later, but it can sometimes come on pretty quickly. A sudden loss of taste and smell may even precede the other symptoms. It's not universal, but it's surprisingly common, that loss of taste and smell. And it also can present with GI issues like diarrhea and nausea. Now they're talking about COVID-19 as sort of the great masquerader of other things. I mean, it can present almost any way. So this is not exhaustive, but we felt like these are the most common symptoms of COVID-19, and these are the ones that we want people to look out for. So just to kind of be aware of what's going on with your body. Then, if symptoms appear, we're asking the resident and all cohabitants of the home to self-isolate immediately and contact one of the people on the health team. And what self-isolation means, it means going into your condominium and staying there. There's no movement through the common spaces at all. You don't go in the walkways, you don't go in the stairwells, you don't go in the elevator, you stay at home. And that's partly because we know that viral shedding is the highest among people just prior to and right at the beginning of their acute illness. And so the risk of spreading to others is very high just when people are starting to figure out that they're sick. If they're sharing a home, and we do have, of course, some couples, the ill person would self-isolate to a bedroom alone, preferably using their own bathroom to reduce the risk of passing to co-inhabitants. and that the ill person inside that home, if they are in the same room for some reason, the ill person and the caregiver should both be wearing masks. And we also referenced in the guidelines, the CDC has guidelines both for how to be a sick person and how to be the person caring for the sick person. So those are referenced in those guidelines. If you look at the resources and read through those, you'll see those references. That reminds me of one thing. When we wrote our precautions for level 4, by the way, and you're going to look at those, you may notice a glaring hole in that we realized yesterday when we had to call someone to repair our elevator, is that we forgot to go back and put in that all workers, emergency workers coming into the building, needed to wear masks. So we're going back to fix that. So if you look at our level 3 guidelines and you think, oh, they're not making them wear masks, we are. We just are fixing that today. So this is how to think of yourself when you're sick with COVID symptoms. It's just, you have to imagine that you're just walking around in this sort of cloud of viral shedding. And this is why we ask you not to come out, is because everywhere you go, you're going to leave droplets and particles and contagion. So one of the most frustrating things about this, particularly in our building and particularly with our residents, is that we can't help very much. We have what's called a mitzvah squad, what we call a mitzvah squad at PDX Commons, and that's a small group of people who coordinate community response to help people in need in the community. So they, for example, will bring meals to people who've had surgery or send cards and flowers to people who have a loss. The mitzvah squad is ready to help, but they can only help you with stuff that does not involve stepping into your home. None of the community helpers, nobody from our community will enter the home of anybody who's sick with COVID. And that's going to be very difficult. And it's because we don't have the PPE, the personal protective equipment that would protect us from active viral shedding by that acutely ill person. And so that means that anybody who enters the home of somebody who's sick and leaves again would have to go into quarantine because they're now exposed to that illness. We don't have a bunch of N95 masks and gowns and face shields and things that would allow us to be in that place without coming out uncontaminated. And that would just spread virus around the community. And so this all includes the health team. Although people are used to us coming into their homes and being helpful to them, we can't do that this time. And that just, it breaks our hearts to think of people being sick in their homes and we can't go in. We haven't figured out a way around that. We haven't figured out a way to sort of create some sort of spacesuit or something to allow us to do that. If a caregiver is brought in from the outside, and that might be particularly for a single person, that person would be required to self-isolate inside the home. So come and go caregiving by friends, families, or professional caregivers is not allowed. That person, if you bring in a caregiver, say adult child or a friend who says, I'll come in, I'll stay with you, they have to then quarantine inside, isolate inside with you. They can't come in during the day and then go home at night and then come back and go home because that's a contaminated person moving through common space. So all of our common spaces, including our guest rooms, are not available to be used by anybody caring for a person with COVID-19 symptoms. And again, this feels so draconian to us because it's so different than our usual way of being welcoming and helpful and supportive. And we just can't figure out how to do it without putting other people in danger. So another part of our plan is making sure that people are in touch with their primary care providers, that they're not relying on us, the health team, for their medical advice. And partly it's because we also know that people in our community, their healthcare providers will have different criteria for them when they should be seen, when they're sick enough to require an in-person evaluation. Generally, that would be worsening shortness of breath that interferes with simple activities. And people who are sick with this often times will say, I was so sick, it took me 5 minutes just to get up and walk to the bathroom because I had to stop and, try to catch my breath. Or you'll see sometimes that people can't talk and they can't speak an entire It kind of sounds like they sort of have to stop and take a breath in order to finish their sentence. So that becomes a cue. And sometimes people don't feel like, I don't feel that bad, but when they can't say a whole sentence without stopping to take a couple breaths, we know that's a problem. The increasing inability to take care of themselves at home may require an in-person evaluation. Certainly following oxygen saturations, if we've got a pulse ox in there and we're asking them to measure their pulse oxes. By the way, you know those pulse oxes, those are those ones that fit on the end of your finger. So it's really easy. You just put it on your finger and it gives you a number. So it's not hard to do. Any other new acute symptoms? So again, we have our guy who's got diabetes. I mean, his doctor may have additional criteria or different criteria, but these are sort of general criteria for most people. If a transfer to a healthcare facility is advised, then that ill person needs to contact a member of the health team to get them out of here without contaminating common space. So the health team is creating ways to move a sick person out of the building without contaminating everything on their way out. So that's kind of the short and dirty guidelines for COVID sickness. That's a twin document to this one. So we move from sharing those guidelines so people kind of understand how this is going to work to asking people to create their own plan. Every individual, even if they're married, every individual creates a plan for dealing with a potential illness. So if you get COVID, what's your plan for that? So again, we're trying to help people understand that this might evidence as something, if you're really lucky, is almost nothing, maybe barely noticeable as a little kind of chest cold. But in some people, it's a fairly severe illness for a couple of weeks. And part of the problem is this ongoing oscillating high fever that oftentimes will go up at night and then down during, I got to watch my hand. It oftentimes is higher during the night and lower during the day. And it really drains people. And we know of people who have had fevers for daily, high fevers, over 102 for 1, 2, or more weeks at home. And those are usually accompanied by chills and sweating, oftentimes mild to moderate shortness of breath. Sometimes oxygen saturation stays okay, and those people don't need to be seen. We just keep an eye on it. And along with that fever and just kind of the attack of the virus on your immune system, there comes this weakness. People talk about just barely being able to move out of their bed, which is partly why we're concerned. We're concerned for people being that sick in their home alone with no eyes on them. And so that's kind of what we're trying to think about in advance. And sort of lack of interest, you just sort of lose interest and motivation to even take care of yourself. So that's what we want people to think about. If you don't get that sick, yay! Maybe you can even be one of the ones who gets asymptomatic antibodies. Let's go for that. But we need to be prepared for something that's considerably worse because we are in a high-risk group. So again, keep in mind that as a community, we can't, and then we have a whole list of things we can't do for you. We can't substitute for the advice of your healthcare professional. We can't come in and change your sheets and deal with your laundry. We can't come in and make you food. We can't come in to assist you to move around. We can't come in to check your vital signs. We can't come in and clean for you. We can't come in and do your pet care, clean up your litter boxes for you. We can't come in and pay your bills for you, which isn't something that I didn't write on here, but people might want to think about. And we can't really fix this for you as much as we wish we could. There are some things we can do. We hope to provide digital contact on a regular basis to make sure you're hanging in there. We want to support you digitally and following the instructions of your healthcare provider, including remembering medications and monitoring your vital signs. We can certainly drop food outside your door. We will pick up laundry and trash at your door following safety protocols. We can assist you to move through the building safely if you need to leave for an appointment or evaluation. We can bring up groceries and deliveries to your door. We can walk your dog. So these are all things that are basically done from outside your door. or digitally. So when we ask people to write their plans, this is the prompt. If I develop symptoms of COVID-19 and have to completely isolate myself from the community for what is likely to be at least 2 weeks, what's my plan? And just one little note there is that's regardless of a positive test. With COVID-19, if it looks like a duck and quacks like a duck, we're going to call it a duck unless somebody can prove to us that it's not a duck. So if it looks like COVID, it doesn't matter if you've got the positive test, we're going to treat it as such. So the first big question is, where do I want to be? Now, most people would probably say, well, I'm going to stay here. But there are other options, and particularly for our single people who would have to be sick alone at home, we're really encouraging them to explore other options. Do you have adult children on the area? Do you have friends who still live in a big house who would give you a bedroom and a bathroom, and you could go be sick there? Some of us have second homes or cabins that we could retreat to if we felt that that would be better so that we avoid some of the contagion risk in the community. We have one person who I thought this was very creative. She bought a tiny home. She put it on her son's property here in Portland near his house, and she figures she'll just isolate there. So she bought a tiny home. It's being installed this next week, and she's going to be ready to go. She's said, I don't want to stay here and be sick by myself, but I don't want to be in their house. So there's all kinds of ways. I would encourage everybody to consider all of your choices and talk to your family. We have a surprising, maybe not surprising, number of people who say, I don't want my kids to get involved in this if I get sick. I don't want to bother my kids. It's like, you might want to talk to your kids about that, because your kids may very well really want you to be with them if you're that sick. They would much rather take that on than to have you be sitting here with people unable to come in and see how you're doing. So I really want people to talk to their family and make sure the family knows, if I get sick, I'm going to be here mostly by myself. So if you're isolating with a spouse or cohabitant, you have to think about how am I going to isolate myself from that person. Now, we do have one couple here at PDX Commons who live in a 1-bedroom unit. And so isolating from a sick spouse is going to be quite a challenge for them. And they wrote a plan and said, I guess what we're going to do is we're going to get a cot, a camping cot, and one of us will sleep somewhere in between the kitchen and the living room place. And sure enough, they ordered a cot and they're ready to go. But they would not have if we had not forced them to make a plan. How will that person then isolate from the rest of the community, given that they're not allowed to move through our common spaces? And then the bad question, and this is throwing people for a loop. What if we were exposed together and we're sick together? And so this spouse person that I was thinking would be my caretaker is also sick. What if there's 2 of us sick in here at the same time? How are we going to manage that? And our couples are very irritated that we're asking them that question. It's like, really? That's too much. If you are going it alone, we have a lot of people in our community who are what are called, I guess, elder orphans. So they're people who are not married and have no children, and oftentimes no close family. So this is a very hard question for them. If I live alone and plan to try to remain isolated alone, how will I find support I need if I'm really sick? And this is such a scary thing. So what we've done is we've asked everybody to make an agreement with a PDX Commons buddy, someone who's going to be sort of your support person, your point person, your go-to person, and the liaison with the health team and the mitzvah squad. Someone that you feel really comfortable calling and saying, things are not going well here, I need some help. And someone who's going to check on you on a really regular basis. The health team and mitzvah squad and the buddy are all going to be standby, and we're all going to be doing digital support, but there's very little we can do without PPE, without risking our own health and the health of the community. And so I'm also encouraging them to think of a backup plan if it becomes too much, if it's just too hard and they can't take care of themselves anymore. For many people, that would likely be be evaluated to go to the hospital. At that point, if they're so sick they can't take care of themselves, they probably should be in the hospital. And since our area hospitals are not full, it's maybe likely that they would get a bed. If you're in an area that's surging, that may be even more difficult, because if hospital beds are full, you may have to have a medical indication to be admitted. So on the plan, we're asking people to specify for us, how will I meet my needs for food, for surveillance of my condition, for all the pet care that my pets need, including changing litter boxes and feeding and walking my animals. How will my laundry get done if I don't have an internal laundry? And most of our residents use common laundry. How will my trash get out? How will I get medications if I need them, or other supplies if I need them? If I'm having trouble contacting my healthcare provider, who's going to help me with that? What other needs might I see? And like I say, I saw on another list that we didn't put on our list, but I think is worth having, is if I have bills that need to be paid, who would help me with that if I'm just too wiped out to even think about it? It's really important that we maintain communication with everybody who's sick. So we're asking them, do you have communication technology that can be utilized from your bed? You know, not like some kind of a desktop computer, but something from your bed that has video access, because video can tell us a lot about how people are doing. So does it work? Are you familiar with the platform? And does your family know how to reach you? We also want to make sure that they've checked with their primary healthcare provider's office. All the primary healthcare providers, in case you haven't noticed, are going to telemedicine. So it's really important that people know how to access that telemedicine. Do you know how to use it? Do you know how to get into it? Can you get help 24/7 so that you can get advice if things go really south in the middle of the night? So it's amazing how many people hadn't thought to do that, is to check on, does my provider have telemedicine? Oh, maybe I should figure that out before I get sick, not wait till I have a fever. And then, of course, that arrangement with the buddy is we're really asking people to do that. And again, that's a little bit interesting because we have a few people who still remain very private. Sometimes they're more willing to have one buddy than to feel like they've got these two different teams sort of breathing down their neck, trying to help them when they don't want it. Then the final readiness check is what's your plan to stock up on your food and supplies to help cover that 2 weeks in strict isolation. And here's the prompt question for that. If I woke up tonight in the middle of the night with a fever of 102, and I'm not leaving my home anymore for the next 2 weeks, I'm not stepping outside that door, am I ready for that? And I would guess, you know, we would all say, well, I'll get stuff as soon as I'm thinking I'm about ready to get sick. And, you know, it's just really hard because you don't usually get much warning. And once you know that something's going on, you just can't be running around going grocery shopping. So it's really important to keep things stocked. And this is going to go on for a long time, people. We have a emergency contact form here at PDX Commons. And so one of the things we're asking people do is, if they haven't already filled it out, and about 2/3 of the community have filled out these emergency contact forms, and we have those on file in our office. We have about 1/3 of people who kind of haven't gotten around to it yet, but our question is, if things went south for you really fast and you couldn't help us figure out who your contacts are, how would we know who to call? How would we know who to call for you? So we've been seeing more of those emergency contact forms coming in from people who sort of, I'm not sick, I don't really need that. The emergency contact form that we use, by the way, will also be on your resource list. So if your community doesn't have anything like that, you may want to consider instituting. It's voluntary. We're not forcing people to give us contact information, but we have, again, enough single people and enough people without close family that we really wouldn't know who to call if we found somebody in a medical emergency. And then what we're asking people to do once they write their plan is that they contact any member of the health team to review it with them. And that's been really helpful for people because sometimes what they think and what's realistic are not quite the same. So we've modified a few plans. We ask people to share the plan with their family members and loved ones so that their peeps know what their plan is should they get sick. And then we ask them to tape it on their fridge or put it someplace obvious so that if they need to find it later, maybe in some months, they can find it and review it. And then we're sort of like saying, once you've thought this through, once you've created a plan, then go do your life, do your life, because actually taking some of that low level anxiety of sort of, oh my God, what will I do? What will I do? And getting it down on paper actually, I think, allows people to sleep better and to move on with their life. So it removes some of the generalized anxiety that I don't really know what I would do. I don't know what I'll just figure it out later. So that was the end of the slide presentation for the community. I've got a few more for you. One is that the health team has not stopped yet because there's 7 of us and we always have something more to do. So we're creating more things, not for community approval, but for us to use as part of our own effort. We're creating a worksheet that we can fill out for whichever one of us does an initial assessment on a new illness. We have a worksheet that helps us keep track of all the digital contacts we have with an ill person. We're going to have a med list worksheet that we're going to use to help making sure that people are taking their meds even when they're sick. We're going to have a worksheet for the mitzvah squad to use to help make sure that the other types of needs are getting met. We're going to have a protocol so that we know how to do contaminated laundry safely. We're going to have a protocol that helps us do safe transfer of the ill person out of the building without contaminating the building, and create a transfer worksheet to go with them. And we've also created sort of that hospital go bag list that a couple people have asked us for, like, what would I take to the hospital if I have to go? And so we've created that list as well. I'm not sure I put that on the resource list, but if you guys are interested in that, I can share that too. The rest of these are pretty much still in development. So you can see we like to make work for ourselves. Another piece that we've talked to the community about for 3 years is advanced planning. And that's my specialty area, so I tend not to let it go. I tend to bring it up on a regular basis. Do you have advanced directives? Do you have advanced directives? Do you have advanced directives? This is a really good time, this era of COVID, to have advanced directives. So I even encourage people to have a special COVID-19 addendum, because advanced directives are usually set up to be sort of a broad, sort of non-specific instructions if I find myself in an end-of-life situation. COVID-19 illness is predictable enough in terms of the serious illness that you can be much more specific about where I would go and where I would say, no, I'm sorry, I'm not going there. A number of people in our community, for example, would probably say, I do not consent to be intubated. That would be too much. We know that the survival rate is low, and that's difficult. We ask people to consider with their COVID-19 decisions that their family won't be able to be with them, that they'll be hospitalized alone, which is one of the kind of tragedies of this whole thing, is that people are hospitalized alone because visitors are not allowed. And there's not enough PPE for the healthcare staff to move in and out of your room to spend time with you. So there's a lot of alone time in the hospital. So making sure that your wishes are known, documented, and fully communicated to your family, your loved ones, and particularly your legal decision makers is so, so, so important. And if any of you want more information about that, my educational service that I do for people, I created a webinar on that, and I think that Karen will also put that link up for you if you want to listen to that. And that's very specific about how to do advanced planning specifically for COVID and where those decision points are. So what's up next? What we know, and I think it's becoming increasingly clear to us that, you know, those curves we think about, let's see if I can go on the right side of my screen, up the curve and then back down the curve. And we sort of had this notion for a long time, if we could just get over that peak curve, we're going to flatten it, and then we're going to come down the other side, and somehow it's all going to be better. We're starting to realize, yeah, that's not going to happen. And what we're going to end up is that curve may not drop very much, and we're going to end up with this, what we call that kind of wavy high plateau, as we sort of play with social distance restriction lifting and in increasing cases that results, and then bringing those restrictions back and calming it down. So we're going to see a lot of wave going on for a long time. What that's going to mean is that as communities, we're going to have to figure out how to deal with this. I think it's going to be at least a year. It could be more. There's people who are optimistic and say 12 to 18 months. There's people who are less optimistic and say it may be 2 to 3 years. But what we know is that we're not going back to what things were in January. That's just not going to happen. So the questions that we have to think about, oh, here's some of the criteria. If we can develop a preventative drug, like they now have a preventative cocktail for HIV, that's going to take a while. The effective and safe vaccine is going to take a while. It's possible they could stumble onto an effective antiviral treatment that would prevent the most serious illnesses, or maybe most of the most serious illnesses. But what we have to remember about all three of these is, even once they're developed and tested, is that then we have the whole idea of production in vast quantities and distribution, which, if testing is any indication, is not going to be very efficient. And so that's why there's some pretty pessimistic views of how long we're in for this dance with COVID-19 threat. The other option, of course, is herd immunity. Over time, more and more people, we think, will develop immunity. But herd immunity, which causes a natural dying out of viral spread because there's too many immune people and there's just not enough people for the virus to jump to, so it sort of dies away. That would probably take 70% of the population to have immunity-ish. And right now we're sitting at probably somewhere between 3 and 10% of the population having immunity. So we've got a long way to go, and that means a lot of time for people to get sick and a lot of time for people to die. So it's really a tough one over the long haul. So what does that mean for co-housing? We're going to have to ask some tough questions in our community. Specifically, as our stay-at-home orders are lifted, as they're starting to be in some parts of the country already, and many of us in the next 4 to 6 weeks are going to have our stay-at-home orders lifted. Some of you may live in places where there's no stay-at-home orders, which is hard to imagine, but apparently they're out there. But once those are lifted, we have to decide as communities what we're going to do. We're not under the same economic pressure that governments, the exterior governments are on to get businesses open. Our concern is how to protect our communities and the health and safety of our community. So how do we back out of social restrictions once our stay-at-home orders are lifted by governmental agencies? When, how, and how quickly? Those are going to be hard questions, and what I've discussed with our health team and with members of the community is I think that's going to be way harder than what we've already done. I think moving into the crisis and climbing up that curve, everybody was alarmed. Everybody was like, oh my God, we got to do something. And people were willing to get on board. I think as we move into something that has to be sustainable over a long period of time for us, I think we're going to run into a lot more conflict about how much social restriction is reasonable within communities. And I don't know the answer to that. I'll get back to you in a couple of months and tell you how PDXC imploded over this one. How much social restriction are we willing to accept for further risk reduction? And how can we balance that sustained quality of life with a tolerable risk of infection? How do we get to that balance for an entire community so we don't just end up having some kind of free-for-all where some people are out traveling around, visiting family around the country, and other people are still hiding in their homes, terrified to come out because they are worried they're going to die. Is it possible to find a middle ground with this? And I'm not sure what the answer to that is. So I'd be interested in hearing your thoughts about that. If anybody's way ahead of Oregon and has already figured this all out, you just let me know, because I'm done with the presentation part of this thing, and this is my contact information, by the way. I am not an expert. I just enjoy pretending that I'm one. And here's all my contact information and the contact information for PDX Commons. So that will be available to you if you want to drop me an email and chat with me. But in the meantime, I'll turn it over to whoever is running the chat.
So I'm going to pull up my chat, although, yeah, it's been pretty quiet in the chat. I think you just had us all sort of spellbound with so much really good information.
Is it too much? Are you all just kind of like, wow?
I'm seeing some thumbs up. Yeah. I mean, yes, so much great information. So I promised everybody a break, and I'm going to say, let's take like 3 minutes, get out of your chairs. I bet Gretchen would agree, if we want to keep our health up, sitting for too long is a bad idea. So let's take 3 to 5 minutes to get out of your chair, go do a bio break, whatever you need to do. And
think of your question.
Think of your questions. Yep.
And I would encourage you also to go ahead and send this on to other people, send that link on to other people who didn't make this chat, because I know there's a lot of communities out there who are struggling with these issues and don't know what to do and don't have the good fortune of having 7 retired healthcare professionals as part of your community. So yeah. We've spent hours working on this, and we want it to be freely shared. So if you know of people in other communities who are struggling or just don't know what to do or just aren't doing anything, hook them up with that address once all that stuff is there.
And I would chime in and say, certainly that's true of co-housing communities. Many of you will be connected to other sorts of communities. And what we love about, one of the things that we're just passionate about with the association, is that what we learn in co-housing can benefit other types of communities that don't actually live in co-housing. So, you know, spread that out there.
Yep.
Do we pass it along to Trump, or do you think he might not?
Yeah,
not so much. Not so much.
I'm guessing it's not going to do a lot of good. I think that we just have to be smarter. And that's one of the things that we're trying to impress on our residents, is just because due to economic pressure, the government makes decisions to open up before we're safe, doesn't mean we have to follow suit. And so that will be a long discussion that we're going to have over Zoom, apparently, because we can't get together to have this discussion. But I think it's going to be a tough one, for sure.
Yeah.
Is how much we're willing to accept the risk of others in the community moving out into the world again and perhaps coming into contact with COVID before we've got testing, contact tracing, and that kind of stuff in the works. It's going to be a hard question.
And Gretchen, that's an excellent setup for our announcement of next week's web chat is going to be how to have conversations on Zoom and how to use tools and online things in some creative ways.
Yeah.
Maybe beyond what you've seen. So the next 2 weeks are currently slated
And that's going to be,
So.
and that's going to be so important because there's going to be a lot of emotional content to these discussions, which I think is really hard to do on Zoom. We just don't have enough cues, I think, to understand what other people are really trying to communicate to us. So, and there's going to be a lot of deep emotion about, I've got a 90-year-old dad out there. I've got a 90-year-old dad out there living alone. I have to drive 4 hours to see him. I've got to go see him. But does that compromise somebody else in my community to a point where they can't bear that? So,
Dina, go ahead. You'll need to unmute yourself, please.
Am I unmuted?
You were there. There you go.
Okay. Yeah, my question is, we have an atrium where people, share that common space, but we also have an exit. We can exit in another way that doesn't involve any common space. And it sounds as though your community does not have that. Is that correct?
we have multiple exits, but there's no way to get up to our homes without moving through common space.
Right.
So I think that's what makes us unique and which makes it a much harder challenge. If there was a way that you guys could get into your private home and out again without moving through any interior space
Right.
that other people had to be in, you would not have to it would be a little bit easier, but it wouldn't be a whole lot easier because the sick person still has to be isolated and the spouse or helper still needs to be quarantined because they're not supposed to be running around out in the world when they have known exposure to COVID, right? But you wouldn't have to worry so much about how to get people in and out of a building without contaminating common space.
Right.
Does that make sense?
Right. And the period after, like how to relax. People could kind of choose their own.
Pick their own poison in a sense, but also because I think many communities still find ways to be together at the appropriate physical distance. So, they're staying 6 feet apart, but they're finding courtyards and sometimes great rooms or backyards or spots, oftentimes outdoor spots. We go on our roof a lot. We're finding those places, and I think that if people are worried that other people, in fact, could be carrying COVID, I think those start to get more tense too. For PDX Commons, one of our greatest gifts is sort of the sense that we're all staying put. And so our risk of infection is low. Even though we're maintaining 6 feet distance, we're still doing courtyard happy hours and yelling across the walkways. We do a little exercise class up on the roof where we do stations that are probably 8 feet apart. So we're doing a lot of stuff that's still in person, but I think that's going to get dicey once we start opening up and people are running around outside more.
So I had a question about, you talked about thermometers and pulse ox, and I'm wondering if there is guidance about what to buy. Like, how do you know it's a good one, or how do you know it would?
One thing, almost any thermometer is going to be accurate. Most of them are digital now. And so, you don't have to get anything that's really expensive. Almost anything you can get your hands on now is probably fine. And it's hard to get your hands on them because most people have thought, oh, I should have a thermometer. The pulse oxes, the least expensive thing you can do is go to the app store and try to find an app for your phone. Did you know that you can test your oxygen by putting your finger over a camera lens on your smartphone? Who knew? The problem with that is that it's not considered to be the most accurate in the world and probably shouldn't be used if you're really sick. So when we were collecting pulse oxes, we were looking for ones that are more standard quality. But those, you can get them for, I would say $25 to $45 for a pulse ox. If you get the ones that are more like $8 or $10, I think you're probably looking at something that's not the greatest. So I just ordered one on Amazon that was $35 and was very highly reviewed and is supposed to be quite accurate. So you don't have to spend tons of money. I don't think every place needs to have them, but it would be good to have them in your community and know who's got them. They'd be easy to wipe down. So just because they're used by somebody with COVID-19 illness doesn't mean that it's forever wrecked for anybody else. So it could simply be disinfected and returned to an owner who didn't need it at that point in time. So just knowing where they're available is, I don't think everybody needs to rush out and have one.
Great. Looking for other questions. I have another one. So
I've stunned them. I think they're all stunned. They look
I think so. I think everybody's taken in everything they can. Gina has another question. No, go ahead.
If nobody else does. My question is how you got to this point of agreement in the community, because it's interesting that a lot of what we have been trying to do in our community is very similar to what you've been doing, like get people to write a plan, trying to how many thermometers, trying to get oximeters, and there was a bunch of pushback. People were like, we don't want to pay for those. And why are you asking? Like, I'm self-sufficient. So that's to me the biggest mystery is.
Yay for us.
Yeah, tremendous. You obviously had some meaningful discussions, and presumably they're on Zoom, and I can hardly imagine that.
What you can see, and I think is going to be part of what Karen's putting up, is you're going to see the first webinar we did was really kind of what is this COVID and why should we be concerned about it? And a lot of our effort was trying to get everybody on the same kind of factual page. So it's kind of like we all know what we're going to deal with. And so that was the first hurdle. The second hurdle was to get everybody to agree that we sort of need a standardized response. That to have kind of people sort of willy-nilly kind of moving into this and doing what they think, well, this sounds right to me, and is to kind of, and that's always a trick in co-housing, isn't it? Is kind of bending my individual thought about what I think makes sense, kind of bending that to the will of the community. And we had a couple of meetings that were long and hard, and we had the health team ready to storm out at one point and say we're not ever going to do that again because we don't like being beaten up by the community for all the work that we're doing. So it has not been easy, but we've been pretty persistent. And what we've recognized and what has kept us going is the knowledge that I would say 85–90% of the community is absolutely behind us. They are so grateful that we're on this. And especially when the CDC comes out with something or the Oregon Health Authority comes out with something, and we've been on it. We've been on it already, and they're like, you guys are so smart. How did you know they were going to recommend masks? It's like, because we're just good like that. And so we try not to get too bogged down with the individuals who are more independent and kind of like, I don't know why you're bothering me with this stuff. The other thing is that we have to keep saying that for the most part, these are community agreements. There's no enforcement. We don't have a whipping post out and back. We are asking people to put out plans, but we can't require it. Most people are really willing to do this thinking through with us. There are some people who are like, this is none of your business. None of your business what we're going to do if we get sick.
Good grief.
Yeah, I mean, and that's still there. But what I take comfort in is knowing that we've brought it up, that they know what needs to be thought about, they know what they need to plan for. And whether they share with us or not is less relevant than the fact that they've listened and they've heard. And so hopefully if they do get sick, it's not going to be a total train wreck for the rest of the community. But yeah, that's that kind of tension between what's my right as an individual and what's my responsibility to the whole community. Really, really hard tension right now. I don't know if that helped you, Dina, but it was just a lot. It's a lot of work. So look through the webinars and you'll probably be able to figure out sort of the progression of the webinars where we just kind of tried to bring people along. And the same people raised objections every time, but did not block any of it. We had some sideways thumbs, but we had no blocks. So we're here. I feel pretty good about it.
And if I was guessing, I would guess that being a senior community made it a little easier to come to agreement. I mean, that's one space where you don't have the same diversity that some communities do.
Correct.
Risk factor.
Yep, absolutely. Because everybody here, almost everybody here knows they're in the same boat. Yeah. That if they get sick, they have a reasonably good chance of ending up in the hospital. And so there's a fair amount of motivation to keep that from happening. Some of the most resistance is coming from younger members who are healthy and have no comorbidities. So they don't see their risk in the same way.
Yeah. And I would imagine too that the physical structure of your community makes it clearer where the shared risk is compared to a community where everybody has an exterior door.
Right. And then it becomes just your common spaces and how you interact with people out on your property or wherever it is that you're interacting. We have been grateful every day that this didn't happen in the thick of winter when everybody was forced inside because of our ongoing rain and more rain and rain and more rain. So at least we still can be out in the courtyard. And we had, after our Zoom meeting, we have an average age of 70 and we had perfect attendance on Zoom. We had everybody in the community on Zoom functionally at our meeting. We're so proud of ourselves. But it's like after that meeting, we all just boomed. I mean, the courtyard just exploded with people. It's kind of, we're keeping distance, of course, but the idea that I need to be with my people in person still really exists strongly in this community. And we feel so grateful that we are in an environment where we can do that.
I see Judy at Pacific Gardens has a hand up. And Lori, I see you too, but let's get Judy first.
Yeah, Gretchen, I really appreciate the information you've given here, very detailed, and it goes into the more advanced stages of if somebody does get ill and so on. So I appreciate that very, very much. I just want to say that I'm in a multi-generational community, so that does complicate it a lot. Right. Really, it does. But I've been gratified that our community, which is very consensus driven, and we usually go around and round in circles, making sure everyone has a say. This time with this life and death thing, I was very pleasantly surprised by how people were on board with switching to a modality that was more responsive, and I'm very grateful for that. But I just want to say one thing, and that is that I attended one of the earliest, if not the earliest, of these COVID things that Coho US organized, and there was a representative from a community called Jamaica Plain in Boston, and he shared his community, and this was really early. His community had already developed stage 1 through stage 6 protocols, and he shared them in that webinar, and I grabbed that from him and I took it to our community, and we had an incredibly decisive meeting in which in one meeting we just adopted all that. Wow. Barrel. And I emailed that man afterwards and I said, you know what, it wouldn't surprise me if you've saved lives by sharing this document. Yeah. I'm serious. This is one of the benefits of belonging to the larger co-housing fraternity, continent wide. Yeah. I just cannot say how grateful I am for that. And Gretchen, for yours as well. Thank you.
Oh, thank you. I'm so glad that those of us who put stuff out there, people are finding that useful. Sounds good. And I think you're really right about multi-generational. What that does perhaps offer a multi-generational, and I'm not sure that you want to do this, but it may offer the ability for someone to volunteer to be a caregiver for, say, a single older person. If their risk of developing serious COVID illness is less, they may choose to volunteer to isolate with somebody who's sick. We just don't have anybody in our community who's considered that safe. So it puts us in a real bind. It's very hard to leave people be sick alone. So who else had a question?
Lori had a hand up. Go ahead.
Yeah, well, a couple of things. We have had a couple of younger people here at Muir Commons who regularly do shopping for people. They just say, I'm going to the store. What do you need to pick up? Now, is that protocol from the East Coast, is that available online, Karen? The protocol that
Judy was mentioning?
Yeah.
I don't know that I picked that one up. But Judy, if you want to email it to me, I can add that to something.
Yeah, sure, Karen, I'll do that.
That sounds very useful. I love the idea of not having to reinvent the wheel. It's a very useful idea. In terms of it's kind of nice to hear. I'm from Muir Commons, Lori Friedman, and so we had that debate too between people who really wanted to exactly follow the rules, stay in their house, just go out as legally, according to the rules, and those who felt, look, if we're safe and take care, it's really probably okay.
Trust me.
It's nice to hear that everyone is kind of having those issues. I didn't want to feel, but we still, it's interesting. We're never able to really resolve it. I think we're basically going along the more conservative line just because it makes those people feel more comfortable.
Yeah,
but we weren't ever able to come up with a compromise like, you stay in your house and we'll go out.
Yeah, if I can say something about that, I think one of the things I did send to Karen is, I think I sent it. We've got so much stuff. It's the graphic for risk tolerance, and we kind of created a graphic of risk tolerance. And what we tried to do is to create a sort of an area of safety for PDX Commons where we kind of exist in this shared understanding of how we are in this space. And then within that, people could choose to restrict further. So in other words, we kind of have our outside boundary, and then people can choose for themselves, I don't feel comfortable with that, so I'm going to restrict further. So for example, within our building right now, we have people who won't come out of their places unless they're wearing masks. Even when appropriate social distancing is being maintained. We have people who will not sit down in the courtyard, even, out in outdoor air, even with chairs at least 6 feet apart. It's just like they don't feel comfortable with that. And we're trying to make that very okay. But we kind of have this outside boundary is, these are kind of the rules we all have understanding about. These are our outside limits, but you can choose to be more risk intolerant if you want to, if it's important to you. So we're trying to keep people safe, but not force everybody exactly into the same box.
I think the people who feel they need to be totally following the rules feel uncomfortable with having other people not. Because maybe it's safety issues, probably, they might,
And we've actually run into disagreements within our health team, and we agree on almost everything. I mean, we've done a lot of work together, but we've actually run into disagreements within the team about some of the, can anybody meet in the great room? And we had some people who say it's just absolutely unsafe because this aerosolizes. And I tell you what, too much medical knowledge is not a good thing. Because we're like, it's not just droplets, it's aerosols, and it hangs in the air, and you know, so nobody can be in this room, and
Right.
and so it's really hard to kind of sort through what is really high level fear, because I read an article that said this, and what is something that's reasonable and sustainable for a year. You know, this is going to be a year, maybe 2. How are we going to live our lives here? We can't live in lockdown in community to this degree. So where are we going to give, and how are we going to find ways to mitigate risk and still do community life together? You get that, right, Lori?
I sure do.
And I want to
Karen,
move towards wrapping us up if we can.
Yeah,
here.
if someone else has another question, I don't want to hog all the
we're
questions
we're about out of time, so I think we're landing in a really good place, which is, you know, it's the age-old co-housing stuff.
It is.
We choose to live together, even though we're different, even though some of our beliefs and philosophies and values are different, because community in the end is so precious that we tolerate that. And I think another theme here is, while we'd love to know for sure what all the consequences are, the fact is we don't. That there's an awful lot of uncertainty in the mix, and how both of those things, the differences amongst us and the uncertainties of real life, make this all harder.
And I would say, Karen, that in addition to that is that all those tensions are writ large when we're talking about this immense, potentially fatal thing. And they're with no end in sight. And so everything becomes much more complicated.
Like
and
community through a magnifying glass.
Yeah. I mean, and the emotions are really high, and an existential threat is a pretty big deal. So Thank you guys all for coming and joining me. I hope it was helpful for you.
Thank you so much. I want to do our usual closing remarks. A reminder again, if you haven't donated or haven't donated recently or haven't become a monthly Evergreen Neighbor donor to the Co-Housing Association, those are the things that allow us to do this. We were able to pick these up and start doing, you know, the continental community support that Judy was talking about because of the donations that had come before that. And we can continue it because of the donations we get now and ongoing. So we know you value this information. And if you're in a position where you can make a donation or increase your monthly donation, especially those monthly sustaining donations, make such a difference for us. So that link is in the chat and on the web chat or on the website as well. We are continuing the next 3 weeks at least of this Tuesday night time, and next week will again be a 90-minute because we're doing a little more heavy content similar to today's. The amount of content I think will be similar, although a little more interactive, because we're going to do how to do things on Zoom, mostly by show and tell. So we'll be doing a lot of interactive time, but a lot of Zoom tools next week. And that'll be Megan, Shay, and I are going to play around with those things. We have upcoming events. So if you're stuck at home and don't know what to do with yourself, Saturday we have sharing and caring. So those are topics, if you're ready to get together and talk co-housing that's not all about coronavirus. Lots of good co-housing stuff, including some process things, how to work with conflict and how to do sociocracy that might just apply to those questions that we've got going. And I know a lot of communities are gardening a whole bunch right now, and there's some permaculture stuff in the mix on Saturday. So join us on Saturday. That is a registration paid event, was intended to be live, but you know, there are always silver linings, and one of the silver linings is you now don't have to travel to Connecticut to get all of this great information, nor do you have to be available on Saturday. You can register as though you were going to attend as much or as little as you want, and then watch the recordings after the fact. All registered users will have access to those. So that's coming up. We're already registering for our next planned intended to be online conference, which is May 30th, the Heart of Community. So again, all of that good relational stuff is coming up in the programming. So those are both things to register for. Karin, have I missed anything?
Nope, I plugged a few more links in the chat, but all of this information is available on the website as well.
In your One thing, in your Zoom session, could you have a little commentary about being overwhelmed by Zoom sessions? This is the newest thing.
Death
We
by
do know
Zoom.
that's a thing. We are hearing that's a thing. So we will be talking about, things like make sure you take breaks and other strategies for making it more interesting, and also how to combine it with other technologies other than just Zoom. There are other tools that make it more interactive, which I think reduces Zoom fatigue. So if we can make it a little more fun and a little more interactive and a little less lecture-y, that's all part of next week's agenda. Okay. So thank you, everybody. You hung in with us for 90 minutes. We appreciate you. Thank you, Gretchen, for phenomenal information. Mm-hmm. And we will see you next week, if not before.
Sounds good.
Good night, everybody.
Good night, everybody.